Many years ago, a great professor in this area from Massachusetts, Rashi Fine, at a talk that I was at said, you know, you can either scratch your nose this way or you can scratch your nose this way. And doing it this way makes a lot more sense. States like Massachusetts and others have come up with these, you know, crazy, complicated sets of incentives and kind of mandates and this, that, and the other thing to try to figure out some way to get health coverage into people's hands. The intelligent thing to do is what the whole industrialized world does, which is to say we're going to have a publicly sponsored program. It's going to be paid for primarily by rich people and a little less by poor people, the way we pay for most things in our society, or we're supposed to anyway, and everybody gets to enroll in it. That's, you know, we call that Medicare for senior citizens. We call it Child Health Plus for children. That ought to be the deal for everyone in this country, and we in New York State could do it. You know, the Canadian health system works that way. Canadians love it. It started out province by province. You know, Taiwan, paragon of capitalism, does it that way. So does, you know, the rest of the industrial world. Whether we will, you know, at the same time, employers are looking for any gimmick they can that will get them out of the business of paying for health care and leaving workers to pay for it on their own. And I don't know about you, but it seems to me a system that is moving towards saying, well, we're going to let everybody take responsibility for their own health care means if you're rich, you'll get all the health care you need. If you're not so rich, well, you'll fend for yourself and probably go without. You know, that is what we did a couple of generations ago. I don't think it worked out very well, and I don't think we should be heading in that direction. But a lot of people who talk about universal coverage are really talking about heading us in that kind of direction. Where, you know, you'll have universal access to health coverage just like we have universal access to limousines in this country. Anybody with the money can have a limousine.
Great.